Hello, this is Jerri Jackson of the Managed Care Division here at the Alabama Medicaid Agency. We are planning a series of webinars. The first webinar that we'll be going over today will be completing the Patient First enrollment application. We'll be discussing our purpose and our Patient First application. We'll also be discussing instructions and common mistakes that have been made on those applications so far. We'll also be going over Patient First information, and I will give you contact information if you have further questions. Our goal is to have a seamless transition to the statewide expansion to the Health Home program. Currently, we are only in 4 areas of the state. We will be expanding statewide effective April 1, 2015. The Health Home program, as I said before, will be statewide effective April 1st, 2015. The probationary RCOs will be managing the Health Home program under Medicaid's supervision. To prepare for this statewide expansion, providers must complete the following 2 items. First, the PMP must complete a Patient First provider enrollment form, and second, they must complete a contract between the Health Home and the PMP. Both are due to Medicaid by March 1st. The contract between the Health Home and the PMP will be required sooner than March 1st, simply because the RCO will be the one responsible to turn that into Medicaid. If the complete information is not sent to Medicaid by March 1st, this could delay Health Home payments as well as payments to the PMP. Providers must enroll individually in Patient First. This is new. All physicians that are currently enrolled in the Patient First groups, they must now enroll in Medicaid as individuals. Recipients will be assigned to the individual PMP within the group, and the recipients will no longer be assigned to that group number. If a provider is currently enrolled as a group, assignments will be made to the Patient First physicians within that group. These will be made in mass assignment. You may also receive assistance from HP in that assignment, and we'll be sending out details on that later through an alert about how the provider can make their own assignments within the group. The individual Patient First enrollment form may be accessed on our website. The way that it is accessed, if you go to our website and notice down at the bottom of the website, there is a link to information about updating your Patient First enrollment form. If you click on that link, you will need to scroll down to the bottom, and the form is there, as well as the letter that was sent out to each individual PMP. Patient First application enrollment key points. These key points that I'm about to go over are key points that our enrollment supervisor has come across during the enrollment process of the Patient First individual enrollments. The first one is a description of the 24/7 coverage. If you are utilizing a hospital for your 24/7 coverage, a copy of the agreement or a letter on the hospital letterhead will suffice. You must send that in with your Patient First agreement. As I said before, our HP enrollment supervisor has not been receiving this, and so she can't process the application appropriately without it. If you're using an answering service, you need to note the name and the phone number on the Patient First agreement in attachment A, and this can be accessed on page 13 of that agreement. Description of admitting privileges. If another physician or group is providing admitting privileges for you, that must be listed on page 15 of the agreement. The ages admitted on page 15 of the agreement for the provider covering the hospital admissions must cover the PMP's current age criteria listed on file with Medicaid. When the enrollment supervisor has looked at a few of these, we've got pediatricians covering for internal medicine doctors. The pediatrician's age group may be only up to 18, and the internal medicine doctor would be able to see patients up to age 999. Key points related to the Patient First Agreement. Other key points to keep in mind are the mid-level extenders, those nurse practitioners and PAs within your group. They must have a collaborating physician. This is reviewed upon submission of your application. The enrollment supervisor does look at this. Only 2 extenders are allowed per physician right now. Please submit all of your individual agreements for one office in a single mailing. This has caused problems because the individual agreements may not have come in with that one group, and it has to be divided up. It takes time to get those processed. On page 3 of the agreement under EPSDT, if you're currently enrolled in the EPSDT program and you have a CLIA certificate on file with Medicaid, please mark yes on page 3 under this, and you will not need to send in another CLIA or EPSDT application. Key points on the referral process within the group and without the group. All Patient First providers should use their individual NPI number on all referrals beginning April 1, 2015. Referrals made with the Patient First group NPI will continue to be honored until that referral expires or through March 31st, 2016, whichever comes first. All cascading referrals should identify the NPI number and the name of the recipient's PMP beginning on April 1st, 2015. It is extremely important that that PMP's number be on that referral because claims must be filed with the PMP's number on the referral to the specialist. Other key points to remember on office referrals is if you're a Patient First physician that has a CRNP or PA that is assisting you with your caseload, they must use the individual PMP's NPI number and names for any referrals sent outside of that group practice. All PAs and CRNPs within the group practice must use the PMP's NPI number as a referring provider on any claims that are filed. A written referral from individual PMPs within a group practice is not required and will not be required. This also goes for the nurse practitioners within the group. The PMP, when they're making a referral to other nurse practitioners or PMPs within the group, a referral will not be required. Office referrals continued. Will a written referral be needed when an enrolled Patient First provider within a group treats a patient assigned to another provider within the group practice? Again, I want to emphasize that a written Patient First referral will not need to be completed when an enrolled PMP treats a patient assigned to another provider within the group practice. Contact information: you may contact Provider Enrollment at the number listed. You may also contact Provider Assistance Center, and if you have any Patient First policy questions, you may contact LaTonda Cunningham or Gloria Wright at the email listed on this PowerPoint presentation. The HP provider representatives are also listed with their numbers.